I'm Dr. Dave Janda. Welcome back to Operation Freedom Platform and the Operation Freedom Briefings, and our special healthcare segments continue with the great Dr. Peter Glidden. A little background on Peter. He attended Williams College, obtained his BS in pre-med studies at the University of Massachusetts, then obtained his doctoral degree in naturopathic medicine at the great Bastyr University in Seattle, Washington. He's a member of the American Association of Naturopathic Physicians. He also is in private practice of naturopathic medicine and has been licensed to practice naturopathic medicine since 1992. In addition to his great clinical skills, Peter is a phenomenal author, and I encourage you to get both of his books. They're a foundation of our medical library here at the Janda household. Everybody is sick, and I know why, and Attempt to Cure with Holistic Medicine. They're available on his website, but also available at Amazon. Peter, welcome back to the Operation Freedom Platform.
Thanks a lot, Dr. Janda. It's always fun and a pleasure being here.
All right, Pete. Today we're going to attack what Big Pharma is silent about, and that is, could calcium deficiency, be associated with 147 diseases?
Yeah, it's really interesting to talk about this. You know, from my point of view, 30 years of clinical experience, I'm here to tell you that the first, second, and third things to consider when somebody's dealing with a chronic disease is that their bodies have run out of the raw materials that it needed to keep that part of the body healthy, that they're unwittingly eating food on a regular basis that's hurting the body, and they're unwittingly eating food on a regular basis that is interfering with the absorption of nutrients. So all chronic disease and a great many acute diseases are directly related to chronic nutrient deficiencies. And as far as I'm concerned, of the 90 essential nutrients which the human body needs, which it can become deficient in, the number one nutrient to pay attention to is calcium. It is vitally important for virtually every function in the human body, right? Bones, of course. Nerve impulses, calcium, blood pressure, calcium. There's a whole bunch of stuff going on in the body that demands appropriate calcium levels. And 1,200 milligrams a day is what the Food and Drug Administration, recommends. The American Medical Association recommends that we get every day. I think it's more than that. And in my clinical experience of 30 years, I'm here to tell you that every single person on planet Earth, unless they're supplementing correctly, is suffering from a calcium deficiency.
Well, let's talk about supplementing correctly, Peter, because many people say, well, I eat organic foods. I eat foods that bring me calcium. I take calcium supplements. Right. Not all calcium supplements are created equal, though, are they?
Yeah, you got that right. And the thing about it is, right, calcium, bring up a little chart here. Can you see that?
Sure can.
Okay, so first things first, calcium is a mineral. And the human body can't make minerals. Plants can't make minerals. Animals can't make minerals. The only way that minerals get into the food is if they're in the soil that the food is growing in. So calcium's either in the soil or it's not in the soil. The farmers aren't paid to put calcium in the soil, so it's a crapshoot as to whether it's there in the first place. And if you use pesticides or herbicides on the crops, those chemicals prohibit the absorption of any of the minerals that are in the soil, including calcium. So thinking that you can get calcium into the body just by eating correctly is incorrect, and it's a dangerous assumption. You must be supplementing with mineral supplements, essential nutrient supplements, calcium supplements in order to fill that tank. But you're right. All wine is made from grapes, right, but there's a big difference from bottle to bottle depending on the details. So here's a little list. Let's say you go to the health food store and you want to get a calcium supplement because you think Dr. Janda and Dr. Glidden are honest and smart. Okay, so you look at the health food store, there's like 30 different brands of calcium. This one is $10 a bottle, and this one, the super duper uber German, calcium, is $50 a bottle.
Right. Oh, so that must be better.
It must be better. So most people go to the one in the middle. All right.
Yeah.
They'll price shop. They'll get one in the middle. So they get a middle of the road calcium supplement. It says right there on the label, each cap contains 500 milligrams of calcium. So we know that RDA is 1,200 milligrams. Most people can do rudimentary math. So yeah, I'll take 3 a day. I'll have a little bit more calcium than my body needs and life will be good. However, that's a mistake because in one 500 milligram cap of calcium, for instance, citrate, there's about 250 milligrams of calcium. Now, the jury is out on this. Nobody has dialed this in specifically, but the deal is that calcium supplements, most of the calcium supplements available over the counter are about 15% absorbable. So you don't have 500 milligrams of calcium, you've got 250 milligrams. 15% of that is about 38 milligrams a cap. Mm-hmm. In order to hit the 1,200 milligram cap, you need 32 capsules a day.
Yeah.
There's 60 in the bottle, right? Mm-hmm. Most people take 3 and then nothing changes.
Right.
And they wonder why. Oh, those mineral supplements don't work. It just gives me expensive urine. It's a waste of money. No, it's not. You just took the wrong stuff in the wrong amount. I mean, right? I mean, if there's a fire in my backyard and I go to put it out with a squirt gun, it's not going to work.
Right. I'm
using water, but I need more water. I need to turn a hose on it. It'll put it out. It's the same with mineral supplements specifically. The magic is in the method of preparation and how absorbable or not it is.
So let's talk about if you were going to taking a calcium supplement. Now, as a naturopathic physician, you have access to many products across the spectrum. What does Dr. Peter Glidden recommend? And by full disclosure, Peter, operationfreedomhealth.com, the information we have there, the products we have listed, they help support this platform. Full disclosure. So when Dr. Peter Glidden recommends a calcium supplement, what's Peter's plan of action for a patient?
Well, it's easy, hands down. And, there are a number of nutritional supplements which are kind of neck and neck. Mm-hmm. There's probably 5 or 6 really good ethical companies in the world that I'm aware of that have good manufacturing procedures and that they take care of the details. And it's pretty much neck and neck, but with calcium. The Longevity company's liquid calcium, it's called Beyond Osteo FX, is so far out in front of everybody else.
Now, in what way?
It's not even funny.
Right. So when you say that, why is it so far? Is it because it's more bioavailable to what you take, your body absorbs because of what it's associated with?
Yeah, it's the recipe, right? And it's the way that the supplement is manufactured, which I'm privy to, but I've been sworn to secrecy about it. It's kind of like the Coca-Cola formula, right?
Yeah, we don't want to get
the stuff that they do to it, and the raw materials that they use as part of the cocktail make the Longevity's Beyond Osteo FX liquid calcium supplement over 95% absorbable. 95%. That's a big deal.
It is.
That's a big number. So, most people need like an ounce of it a day, maybe 2 ounces. We dose it based on body weight because someone who's 100 pounds is going to need less than someone who's 300 pounds, right? But more or less, if you take 1 or 2 ounces of the Beyond Osteo FX liquid every day, you're going to notice a change within 4 weeks because I'm telling you, everybody is deficient in calcium and nobody knows it. And your profession, right, who are most excellent at surgery when it's necessary, trauma care, they'll keep you alive, stitch up the bleeding artery, pull the bullet out, keep you alive. It's fantastic, but no training, no experience, no education in medical nutrition.
Very true.
So medical doctors are clueless about this, and often they get it backwards, quite frankly, right? Mm-hmm. They'll tell you, calcium causes hardening of the arteries, and you should avoid calcium supplements. No, it doesn't. It's not calcium that causes hardening of the arteries. Calcium does deposit in arteries, but that only happens in the absence of magnesium. A calcium deposition in the artery is due to a magnesium deficiency, not a calcium overdose. Virtually impossible to overdose. I figured it out, by the way. There's something called the LD50 for everything. It's the lethal dose.
Right.
The dose at which 50% of the people who take it are going to die. Right. And water has an LD50. Okay. The LD50 of Longevity's Beyond Osteo FX is 37 bottles.
Whoa.
You would have to swallow 37 bottles in a row in order to hurt yourself. We recommend 1 or 2 bottles a month.
Right.
So thinking that you can overdose on calcium is just, well, there's no politically correct way to say it. It's wrong. 2 + 2 does not equal 5. It equals 4, right? So impossible to overdose on a calcium supplement, number one. And when you start taking a good absorbable calcium supplement into your body, because your calcium needs are so high and because it affects virtually every system in the body, you're going to notice a difference within 2-3 weeks.
So, Peter, when I stated at the beginning that there can be 147 diseases associated with a calcium deficiency, is that an overstatement?
No, it's actually an understatement. It's upwards of 200.
Really?
And yeah, because there are so many systems of the body that are dependent on calcium. So, for instance, the top 4 that I can think of.
Right.
Heartburn is caused by a deficiency in stomach acid, not an excess. And the 2 leading causes of a deficiency in stomach acid are not enough salt and not enough calcium. High blood pressure, one of the leading causes is calcium deficiencies, because your body needs calcium to make muscles constrict and relax. If it doesn't have enough calcium, the muscle will constrict, but it can't relax. So you get tics or twitches or muscle cramps, really bad menstrual cramps, restless legs at night in bed, or the muscles in your arteries constrict and your blood pressure spikes. Calcium deficiency. Kidney stones.
Oh, yeah. That now, Peter, we just went through this this week where an individual had kidney stones. And when you and I consulted about this, we talked about a calcium deficiency, and this individual was like, no. It's not that I want a kidney stone. It's that I have a kidney stone. I can't be calcium deficient if I have a kidney stone. Peter, give us the lowdown.
Yeah, it's kind of, it's not, the formation of a kidney stone is counterintuitive, right? And it's easy to get it backwards, especially if you don't really have any training in medical nutrition. So, number one, the majority of kidney stones are calcium oxalate, and so calcium is definitely involved in the lion's share of kidney stone formation. But it takes kidney stones months, if not years, to form. They don't just happen overnight. So from our point of view, here's how it goes. The body needs this much calcium every day. The body has wisdom. The body knows that it needs this much calcium every day. When the body's calcium reserves get to a certain level of lowness, the intelligence of the body recognizes that and goes into red alert. And the parathyroid hormones or glands on the side of the thyroid secrete a hormone called parathormone, which sucks calcium out of the bones,
right,
and puts it into the general circulation, because the body has a little triage, right? Oh, I'd probably better to keep the heart and the central nervous system healthy, and I don't really care if I break a bone. So that's kind of the rationale. So now we've got calcium being flooded into the circulatory system because of calcium deficiencies. So you draw the blood, and somebody's calcium levels are high in the blood. And you think, well, they're drinking too much milk, or they're taking too many calcium supplements. No, it's the opposite. The reason that it's high is because of the parathormone and the calcium storm that's being sucked out of the bones because of calcium deficiencies. And if this happens, for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 weeks in a row, you've got all this calcium flooding through the blood. It all gets filtered through the kidneys. Calcium gets jammed up in the kidneys and causes kidney stone formation. Now, what will happen is frequently, this happened to my brother, by the way, right? I'm the youngest of 6. My next oldest brother, 6 years older than I am. He started on the medical nutrition program on my recommendations. 2 days he was taking the 90 essential nutrients, the Healthy Body Start Pack. He calls me up. He says, Pete, that stuff you gave me a kidney stone. I said, what are you talking about? He said, I was in the ER last night passing a kidney stone. I said, listen, it took your body years to develop the kidney stone. My stuff didn't give it to you. It gave your body the ability to get rid of it, because your body doesn't want to have a kidney stone. It's like a bullet inside. The body wants to get rid of it. So finally you're nutrified because of the supplements, and your body punches the kidney stone out. And this is a very important thing for people to understand. It's kidney stone formation is a marathon. It's not a sprint. And it happens by chronic undiagnosed, continuing calcium deficiencies in the food. So the cure for it, ironically, well, parenthetically, counterintuitively,
right,
it's a direct diagnostic indicator that you are severely deficient in calcium. So if you've had a kidney stone, especially if it's a calcium oxalate stone, you need calcium supplements and more than the average bear.
And do the vast majority of folks that have kidney stones therefore would be osteoporotic? Their bones would be thin
Yes.
because of this?
It's almost a one-to-one correlation. But, because conventional medical doctors are not trained to make those connections.
Right.
Right. Allopathic medicine is reductionistic, and it takes everything apart.
Right.
So you get one medicine for the kidney, one medicine for the bone, one medicine for the joint, one medicine for the heart, et cetera, et cetera. So they don't make these connections, but we do. And so, yeah, you would see that people that have a history of kidney stones have a history of bone and joint problems, and or one of the other, like top 5 calcium deficiency syndromes. And because this is an interesting thing to talk about, Dave, and
yeah,
this is where I think inheritance comes into play, So you might be deficient in calcium and have bone and joint issues. I might be deficient in calcium and have kidney stone issues.
Right.
Our neighbor might be deficient in calcium and have really bad menstrual cramps and heartburn. And somebody down the street might have high blood pressure because they have calcium deficiencies. And, I think that genetics has something to do with where those show up. But honest to God, if I was only allowed by law to prescribe one supplement, hands down, it would be Youngevity's Beyond OsteoFX Liquid Calcium. It's an awesome product.
So, Pete, let's assume right now that you have a 2-centimeter kidney stone in your left kidney.
Yeah.
Okay.
Yep.
And you just realized you have a 2-centimeter kidney stone in your kidney. Okay.
Yeah.
What would you do?
So you have to get to the root cause of why you had the kidney stone in the first place. So you need to start taking the 90 essential nutrients appropriate for body weight and then a little extra calcium every month, because that's a direct indicator that you are extremely deficient in calcium plus the other nutrients. And with nutrient deficiencies, it's like wolves. It's never just one thing that you're deficient in. There's a whole bunch of things, right? So we check all the boxes and cover all our bases. Everybody takes the Healthy Body Start Pack that gives them everything that they need, and in this case, extra calcium. But then you need to understand that this program is probably going to make your body so healthy that it passes the kidney stone, gets rid of it. And passing a kidney stone is an extremely painful process.
Yes, it is.
Extremely painful, like give me the morphine drip pain. Right. So there are a couple of things that we can do in order to mitigate the passage of the stone and to make it easier for the body to do that. And one of, hands down, I've passed kidney stones twice in my life. And the last time that I did it, I talked to a good friend of ours. He's the founder of the Good Herbs Company. He probably knows more about botanical medicine than maybe there's 2 other people alive on planet Earth right now that know more than he does. In any event, he told me that an alcohol, and I didn't know this, 30 years clinical experience, I think I know everything, right? He said, listen, an alcohol extract of organic corn silk, right? Organic corn silk, alcohol extract. If you take 2, 3, 4 milliliters of the alcohol extract every 30 minutes, you'll dissolve the stone lickety-split. I didn't believe him, but I trusted him. I did it. And I was passing a stone, and within an hour, I was completely out of pain. It was a remarkable experience. So now that's not easy to find. Youngevity doesn't make it. You have to get organic corn silk and an alcohol extract of organic corn silk.
So where did you find it?
I have a colleague that manufactures botanical medicines for naturopathic doctors, right? They don't sell to the general public. It's a really good company. In Arizona. I called him up. I said, look, I need some corn silk. He said, yeah, how much do you want? So, but I'm sure that if you did a Google search, you could probably find some somewhere that you didn't have to go through a doctor's office for it.
So, plan of action for our viewers. 147, well, over 200 diseases associated with calcium deficiency, right?
Yeah.
Right? And single most effective way to address these issues, calcium supplementation. But we have to make sure that that calcium supplementation is absorbed by the body.
Yeah, absolutely, positively. And you need to get the right recipe, and you need to have the right cofactors. So the recommendation is the Healthy Body Start Pack, right, to give the body all 90 essential nutrients, and then one, maybe go crazy, 2 extra bottles a month of the Beyond Osteo FX. Now, the Beyond Osteo FX comes in a powder form,
Right.
and it also comes in a liquid form, and I've seen both of them work just as effectively. It really comes down to taste. I like the liquid better than the powder, but I have a lot of patients who swear by the powder. But that's it. And then, if you think or you might have a kidney stone, for goodness sakes, have a little bottle of alcohol extract of organic corn silk sitting in the wings that you can use, heaven forbid, you do start to pass a stone.
Peter, I'd like to thank you for everything you are doing, have done, and will do. You're an incredible wealth of knowledge, and I just wish that you were a professor when I went through medical school, and you were a professor when my daughter went through medical school, because whether I look back 30 years ago when I went through medical school or more recently when my daughter did, we were not taught. We were not taught about the benefits of naturopathic medicine. And that really is a detriment to every person graduating from allopathic medical schools. And I thank you for being our professor, because that's what you are for folks. Folks really enjoy these segments. And I'd like to thank you, Peter, for your dedication to the health and welfare of millions of people.
My pleasure, Dave. It's always a pleasure spending time with you and spreading our message of, the undiscovered country, our experience of the undiscovered country, right, of science-based, clinically verified medical nutrition. It's really a wonderful thing. And the more people we can get exposed to it, the better.
Information, folks, available at operationfreedomhealth.com. Also, the products are available we discussed. Again, full disclosure, the purchase of the products on Operation Freedom Health does support the Operation Freedom platform. I also encourage you, Peter's books, must have. Everybody is sick, and I know why, and attempt a cure with holistic medicine. Peter, thank you very much for your time and all that you do. And folks, I'd like to thank you for joining us today. Thank you for your time. And until next time, Dave Janis signing off. Dream big and dare to fail.